Welcome to today's web seminar. Can everyone hear me? I was just having some audio trouble. I want to make sure that we are in fact broadcasting. Okay, great. Sorry about that delay, everyone. I thought everyone could hear me, and I was apparently talking into the air. This is Simone Turek-Lee with John Burton Advocates for Youth. Good morning. July 1st. Happy summer. We're in the thick of it. It feels like at this point. It's a little gloomy here where I am in Oakland, but I hope that someone is somewhere where it is sunny and in the spirit of summer. So today we're going to talk about the THP NMD housing supplement, which we're really excited about, is first becoming available starting today in select counties. So I will go over just some technical information first, and then we'll jump into the agenda. So we always like to just provide some tips here for troubleshooting the audio portion of the webinar. If you're listening, most people seem to listen through their computer speakers, but if you have trouble with your computer speakers, your best bet is to switch to using your telephone. And so the call-in information is on the screen there. And if, once I advance past this slide, if you need to use your phone to call in, just go ahead and uncollapse the audio portion of your control panel and then select phone call, and it will show up there as well. Throughout the webinar, please do submit live questions. We'll take them at the end. We'll provide at least 10 to 15 minutes for Q&A. So just type any question you have or comment in that questions box in your control panel and hit send. And then we always post our presentation materials and a recording of our webinar on our website. We have a new website. If you haven't checked it out, just a quick plug for it. If you visited our old website, there's a lot of information there, but it was not as organized as it is now on our new website. So I'm really excited. We have an entire resource library where you can filter and sort by if you're looking for a roster of contacts for various programs, if you're looking for a publication, for a webinar recording, we have all sorts of resources. So please check that out. It's jbay.org. And we post like I just said, our webinar recordings and slides in that resource library. All right, so let's jump into our agenda. So again, I'm Simone Turek-Lee. I'm the Director of Housing and Health here at John Burton Advocates for Youth. And we're going to talk about a brand new resource that it's very appropriate that we're talking about it right now, July 1st. We're all eagerly anticipating the governor signing the state budget, unless it's happened in the last few minutes, and I haven't seen any news on it, but it hadn't happened, I believe, when I woke up this morning, unless I'm missing something. And so we're eagerly waiting for that to happen. And this THP NMD housing supplement was something that was established in last year's budget, so exactly a year ago. And there was a ramp up period, and it's now being implemented. So we're really, really excited. So first, I'll just provide some background about kind of the need and the impetus and kind of how the supplement came about. Then we'll get into the kind of nitty gritty. How does the housing supplement work? Then what's the implementation timeline? And what are the amounts, which I'm sure everyone's interested in, like what's happening in my county, the anticipated impact, and then we'll talk a little bit about next steps. And as I said, we'll do a Q&A. And I just want to clarify, I assume most people that are on this call joined because they have familiarity with THP, NMD, maybe you're a provider, maybe you're a county that places youth in this placement. But for those who might be newer to this field or to this topic, this is the transitional housing placement for non-minor dependents. So it's a placement for youth that are in extended foster care, 18, 19, and 20. And it provides, semi-independent living, usually in a shared apartment with another NMD. And every youth in the placement has a case manager and receives supportive services. So that includes case management, counseling, crisis intervention, assistance with independent living skills development, education and employment support, either direct mental health services or via referral. if the youth so chooses. So there's a whole bunch of supportive services that are provided through this placement. So we really view, access to THP NMD as, access to supportive housing for youth who are preparing to transition into, complete independence. And so we think it's a really important kind of option on the continuum of placements for youth that are in care, that are, young adults. And so, part of the really the development of this THP NMD housing supplement, as you'll soon hear, is about making sure that we all can, that there's access to the program. So let's dive in. So first, we'll talk a little bit about just the background of how this came about. So, SB 612, which was a bill that was enacted a few years ago, it was authored by Senator Holly Mitchell, who is now no longer in the legislature, but was a great champion for youth in care and many other people. That bill called for a work group to establish a new rate structure for actually 3 different programs, for THP NMD, and then also the transitional housing placement for minors, for 16 and 17-year-olds, and then also for THP Plus, which is the program for former foster youth. Now, that is a tall order. That's a lot for one work group. What ended up happening is the Department of Social Services, the Foster Care Audits and Rates Branch convened the work group in 2019, and then said, let's focus solely on THP NMD, and these other programs we can maybe manage addressing the rate issues that we have at a later date. And so the group focused on THP NMD. This was a great work group. It had at least 30 different people who showed up consistently, and it was a really diverse group of stakeholders. There were county representatives, there were providers, there were attorneys, policy advocates, youth representatives, state administrators, kind of across the whole gamut. So the group met over the course of a few months, and it consisted of really 4 full-day meetings, and determined, the first thing was, what are the issues here that we're addressing? So the work group first determined, there are 2 real main issues with the THP NMD rate. One is there's a really high cost of housing in certain counties in our state. We live in California. This is a very expensive state to live in, but no one county no 2 counties are alike. It's very expensive to live in some counties and not as much in others. So this was not something that was affecting youth, equally in every county. So that was the first issue. There was really high cost of housing, and that was leading to inaccessibility of the placement in certain counties. So the second issue that was really discussed was this kind of lack of level of the required resources to serve youth that have extraordinarily high needs. So that includes youth who are parenting, and youth who might have a number of risk factors or who need very intensive mental health services. And so, this is a placement that is funded at, between $3,000 and $4,000 per youth per month. But then between, what's offered in THP NMD and what's offered in kind of the next most supportive placement, there's a huge gap. So, there's short-term residential therapeutic programs that are funded at, $13,000 something per youth per month. These are very resourced facilities. And so, the issue that was raised is that we don't have anything that's in between those 2 options. And so, can we look at some sort of THP NMD placement that can provide an even higher level of care than currently is being provided by THP NMD? People are saying they cannot hear. Is that just one person, or are there others that cannot hear? If people can please, sorry about this. Okay, looks like people can hear. So that may just be a one-off. Anna, if you're on the call, if you can maybe try to help this person troubleshoot. Sorry about that, everyone. So there was this issue of not being able to serve youth with extremely high level of needs. And so that is a very, that's an issue that involves a lot of different departments, a lot of different parties. It implicates the Department of Mental Health. It implicates just a lot of different parties to come to the table and figure out a solution for. And so the work group chose, let's first really solve this high cost of housing issue, and then maybe revisit that second issue at a later date. So we moved forward to address this high cost of housing issue and started coming up with potential solutions. So first, let's just talk a little bit about what this high cost of housing, the impact of the high cost of housing on youth in THP-NMD. So in California, the cost of housing increased by, very significantly over the last 10 years. When you look at how that compares to the increase in the THP-NMD rate, it's a lot more significant. So as you can see on the slide, between 2012 and 2019, when we were advocating for this policy change, the THP-NMD rate increased 24%. And this is based on the annual cost of living increases that foster care rates receive. So these are called the California Necessities Index increases or CNI increases, and all foster care rates receive those. And so over that time period, it's great that we had that CNI rate increase, but the truth is that the cost of housing in California has increased so much that it outpaced those increases, those CNI increases that the rate was receiving. So while the rate only increased 24%, the cost of housing increased a full 64% during that same time period. So because THP-NMD providers are housing youth in apartments on the private market, in most cases, they're competing against everyone else and subject to the same housing crisis that everyone else is experiencing. So the failure of the rate to really keep pace with the cost of housing really limits providers and counties' ability to serve youth in this placement adequately in a handful of counties. So, how does this really affect youth more directly and more literally? So we've seen an increase in the number of youth on the waiting list for THP-NMD statewide from 2018. And this is when we first started collecting waiting list data, so we don't have it going back as far as we do with the housing information. But, from 2018, it was 208 youth in 2018, and it's more than doubled. In 2020, it was 482, and that's the last time we collected that data, and we'll be collecting it again very, very soon, this month, in fact. So that's what we see there. And then you can see that the increase in the waiting list, will actually mean more youth are experiencing homelessness while they wait, because what we know of youth who enter the placement, is that 10% enter directly from homelessness, and 23% enter having experienced homelessness at some point prior to entry, while in foster care. So kind of staying on this topic of how youth have been impacted, there are some other ways that we see as well. So we see the housing crisis really limiting providers' capacities to serve youth whose needs are higher and literally are more expensive to serve. So, in 2019, we asked providers about this issue and how they manage it. And so many providers do fundraise. They privately fundraise to make up for the difference in what's needed to serve young people and what's received through the rate. But some providers don't have that capacity, or they live in communities with very minimal fundraising capacity. There aren't a lot of foundations. There aren't a lot of people who are in a place to donate. And so what we found is that 1 in 3 providers really had to limit who they served to ensure they could cover the cost. So for example, parenting youth are more expensive to house and to case manage, because you're housing and you're case managing a young person and their child or their children. So while a lot of providers, again, don't make these limitations and they privately fundraise, in some cases, counties and providers had to kind of limit the number of, parenting youth that they would take into the program so that they could actually cover the cost. Another issue is that the more funding that's eaten up by rent, the less there is for supportive services. And the supportive services are one of the really big things that differentiates THP-NMD from, a SILP, a supervised independent living placement. The services are very important. And then lastly, housing costs, high housing costs lead to geographic displacement. And this is not unique to THP-NMD. We see this with foster homes too, right? It's hard to find places to place youth in counties that are extremely expensive. One of the biggest, probably most common examples is San Francisco. A lot of San Francisco youth are placed in the East Bay because there is just not a lot of housing where you can place young people in the city of San Francisco. So, there's also issues where, youth might be placed in neighborhoods where maybe it's in their county, but in a neighborhood that's not conducive to them feeling like they're safe, or where it's convenient for them to, travel to school or to work, to get to public transportation. So we were really seeing this issue, impacting youth quite directly. So the work group spent time considering a few different approaches and ultimately landed on the approach I'm about to share with you all, which is the THP-NMD housing supplement, which was written into law last year. So, the work group concluded, and we basically, J-Bay, along with the California Alliance of Child and Family Services and Children's Law Center and Children Now, sponsored a legislative proposal. We stayed in close contact with the DSS rates branch to talk about the technical workings of the proposal, and really moved this forward in the legislature. So we fortunately we're lucky that Assemblymember Phil Ting, who's a champion for foster youth, took this on. He introduced the bill AB 2880 to establish the THP-NMD housing supplement, and then he worked with us on a companion budget request because the bill was going to cost about $4 million. So ultimately, the bill died, but the funding went into the budget, and then the bill language was put into the budget, a budget trailer bill, AB 79. And so that was really exciting last year when that happened. So let's talk a little bit about what this supplement is. What are we really talking about here? So here's just a quick kind of high-level, quick and dirty overview to start. The THP-NMD housing supplement, it supplements the rate paid to THP-NMD providers on behalf of youth placed in their programs. So, providers currently receive a monthly payment for each youth they serve. It's a combination of federal and realigned county foster care dollars. It's intended to cover everything from rent to administrative costs and staffing, direct stipend for youth, furnishings, et cetera, et cetera. For the 2021 fiscal year, that rate's $3,603. We'll be probably today, tomorrow, any day now, seeing a CNI ACL come out with a new rate, and that will also include the housing supplement amount. But the THP-NMD housing supplement provides an additional amount on top of that rate, that 3,600 rate, for counties who are eligible, that covers the cost of excessive housing costs in that county. The housing supplement amounts will vary across eligible counties based on the cost of county. Tongue-tied here. The cost of housing in that county, according to fair market rent, and we'll talk about fair market rent in just a second. There are higher supplement amounts for parenting youth. So this was something the work group felt very strongly about. Yes, there's this high cost of housing issue, but there's even more of an issue when you serve parenting youth, because parenting youth require different housing accommodations. And then lastly, implementation is occurring on a phased-in basis to allow for automation in payment systems. And so that's where we are today. We are seeing the first phase of implementation. We'll see the second phase next year. So just a quick one-slide deal on fair market rent so that people who aren't familiar with this have an idea of what we're talking about here. Fair market rent is not new. This is a system developed by HUD, the U.S. Department of Housing and Urban Development, to determine the allowable rent levels for individuals who participate in their Housing Choice Voucher Program, also known as Section 8. FMR is based on data from a combination of surveys and the census, And, there's a couple year lag in it. So it gathers this data over the course of a couple of years, and then each year FMR is issued. FMR includes the cost of housing and utilities apart from phone, cable, and internet. And then, as I said, each year HUD calculates the FMR, and this isn't just for California, right? This is for the whole country. So for 530 metropolitan county areas, and that includes all of California's 58 counties. And the link at the bottom of the page is where you can check out, your FMR for your county, and where you can learn more about FMR. So just a little bit better understanding, like, is this number accurate? Where does it lie? Is it less? Is it more than what we expect to see in our communities? It's set at a 40% median. So what that literally means is that FMR, so I live in Alameda County. So Alameda County's FMR, basically in my community, 60% of rent is higher than FMR, and 40% of rent is lower than FMR. So it's not a 50% median, it's not smack dab in the middle, but it's a 40% median. So that's, I think, important to remember, because this is, I would call it a bare minimum, right? When you look at FMR, you can't get everything on the market with FMR. This is a 40% median. So it's a minimum that we should be looking at for housing costs. So as we talked about earlier, rental costs vary greatly across the state. So just to give people a taste of this, and many of you are, I'm sure, well aware, especially if you live in certain counties, I picked on these counties because, I gave us the extreme. So Marin, San Francisco, and San Mateo are the most expensive counties to live in California. And if you live there, you're probably like, yeah, no kidding. Modoc County is quite affordable compared to, those counties. And then we have kind of a middle range between the most expensive and the least expensive. And I picked Napa, which is on the higher end, admittedly, when you look at kind of overall number of counties. But as far as just, cost, I wanted to kind of just show people the great variation that there is. We are a very diverse state in terms of housing costs. So a little bit more about the technical workings of this proposal. And this is where things get a little bit in the weeds. So I'll try not to dive too deep into them. And I'll try to say this as simply as possible. But if there are questions that come up during Q&A, we can come back to this and address them. So counties qualify for a housing supplement if their FMR is greater than the housing portion of the THP NMD rate. Now, what is the housing portion of the THP NMD rate, right? Earlier, we talked about the THP NMD rate being about $3,600 a month. Now, all of that doesn't go to rent, as we covered earlier, right? There's a whole gamut of things that need to be covered when you run one of these programs. Staffing alone is very expensive, and staffing is very important. So, the rent is just a portion of that rate. So when it's the portion that's budgeted to pay rent, and what that portion is 21.45% of the rate. So if you look at the arrows on the screen, so in 2011-12, when extended foster care was being implemented and planned for, the housing portion of the rate was $600, and that was determined because when THP NMD was being kind of developed as a placement option, it was modeled after the THP Plus program for former foster youth, which has been around for eons. And they pulled apart that rate and analyzed what that rate, like the average THP Plus rate, what it was based on. And at that time, housing was not as expensive as it is now. And it was looked at that, of the established THP NMD rate, which back in the day, back in 11-12, it was $2,797 per month. And so $600 was thought to be the housing portion, that the rent portion covered within the rate would be $600. And so when you look at what $600 is of $2,797, it's 21, it's about 21%, right? So when you inflate that and you look at where are we today in 21-22, what is 21.45% of the current rate of that $3,679? It is $789.15. So we're looking at today the housing portion of the rate being, about $790. And so that is what we're asking ourselves, is that enough, in San Francisco? Is that enough in San Mateo? Is that enough in Napa? Is that enough in whatever county, right, to cover the cost of rent? And so we look to FMR to answer that question. So the math here is there's two different calculations. There's one for youth who are not custodial parents, so the bulk of young people in the program or in the placement. Most youth are not custodial parents, but there is a portion of young people who are custodial parents, and so there's a different formula for figuring out what those youth need to be, to be renting within THP-NMD. So the top part, youth who are not custodial parents, this is the difference between FMR for 1/2 of a 2-bedroom apartment, because in most cases, youth are placed in 2 bedrooms, they have a roommate. So we don't need the whole rent for the apartment for one youth. We really need 1/2 of a 2-bedroom. So we took, there's FMR for 1 bedrooms, for studios, 1 bedrooms, 2 bedrooms, 3 bedrooms, and so on, right? So we took the FMR for 1/2 of a 2-bedroom apartment. And we said, what is the difference between that FMR and 21.45% of the THP-NMD rate? And so if there is no difference, right, if that's 0 or if it's negative, you don't need a housing supplement. But if it results in some amount of dollars, that would be the amount of the housing supplement you need. And it would go with the county in which the NMD resides. So this is not the placing county, it's where the youth is placed, right? Because common sense, we need to be able to afford rent where the youth is living. So same thing for custodial parents, except we used 1 whole 1-bedroom, because it is a best practice, and most providers do use this practice of placing, or policy of placing, young people in 1-bedroom apartments if they have children. If they have several children, which is quite rare at that age, it might be more than a 1-bedroom, but if they have 1 child, for example, certainly a 1-bedroom is appropriate. And, I do know of at least one provider that has successfully placed youth in shared housing that have children, but I think there are a lot of practices that go with that to make it successful. And for the most part, that is not what is looked at as the go-to practice. And so we're really looking to be able to make sure that providers are funded at a rate where they can use this best practice, where they can place youth in a 1-bedroom with their children, where it's not shared living. And that is more expensive than placing youth in a shared 2-bedroom. So what you'll see in a moment is that the housing supplements for youth that are custodial parents are quite higher, and more counties are eligible for them than youth who are not custodial parents. So let's, another kind of math slide here. So for youth who are custodial parents, we're going to use Alameda County as an example. Now, 2-bedroom FMR in Alameda County is $2,383, right? So that's the full 2-bedroom amount. When you split that in half, it's $1,191.50. So we're looking at our FMR being that $1,191, right? That's what we're looking at. So we're going to take that, we're going to subtract the housing portion of the THP-NMD rate, and then what do we get? We get $402.35. So that is Alameda County's, housing supplement for non-parents. So let's look on the other side at the parenting use supplement. So a 1-bedroom in Alameda County is $1,934. We don't need to split that in half because they're getting the whole apartment. So we take $1,934, we subtract $789.15. That's the housing portion of the THP-NMD rate. And then we get $1,144.85. That is Alameda County's THP-NMD housing supplement for custodial parents. And again, this is on top of the THP-NMD rate. So this is the amount of kind of excess rent that is not being covered currently, and that will now be covered by this new rate. And I will clarify, we'll get into this a little bit later, but the amounts will change year to year. And so I'm using, previous year's FMR here. I believe I'm using, or maybe I'm using current, but regardless, my point is just that, this might be a few dollars difference between what you see in the ACL, because it slightly changes from year to year. So let's jump into the implementation timeline and housing supplement amount. And so just a reminder before we jump in, if people have questions, please do enter them in the questions box as we go along. We'll do a Q&A at the end, and I think we're making pretty good time. I didn't anticipate this would be a super long webinar. We usually do an hour and a half. I thought we definitely don't need that. I scheduled it for an hour, and you know what? We might end early, and I'm sure no one will complain about that because everyone is busy. But please do send questions, and we will get to them at the end. And I know a couple people have asked, is this going to be posted? Yes, this will be posted along with the recording on our website. And I'll also send a copy of these slides and of the recording to everyone later today who registered for the webinar. So let's continue on here. Oh, and I also should have said in the beginning that a copy of the PowerPoint is uploaded into the handout section. A little late, we're halfway through the presentation, but if you want to look at that PowerPoint now, you can go in the handout section and grab it. So let's look at this. Let's look at the timeline here, because this is going to answer the question. I've seen a couple people put questions in about how does this work for their county. So this will answer part of that question as far as timeline. So just a little bit, I want to go into the automation here. This is, the housing supplement. The reason that we had to have this couldn't be implemented immediately is that these rates have to be automated into the systems that are used by counties and the state to process foster care payments. And that doesn't happen overnight, right? There's a whole long line of, there's a queue. There's a whole long line of things waiting to be automated. And so, you get in line and you get your space and you then get automated when it's your turn. Because every year, new laws pass, rates change. And so these folks are constantly working to update the system. So it needed to be automated in the systems. And there are currently 3 different systems that are used by counties. So there's the CalWIN system, there's the C4 system, and then there's LRS. And LRS is just LA County's system. But you can see that the other 2 systems, C4, which that stands for Consortium for, and CalWIN stands for California Work Opportunity and Responsibility to Kids Information Network. If that wasn't long enough for you, you can see which counties are included, that utilize those systems, who they are. So, CalWIN is largely Bay Area counties, also some Southern California and some others. And then there's a large number of, Northern and Central, and then some Southern in C4. But what kind of further made this a little bit tricky is that these systems are scheduled to migrate into one single system called CalSAWS, with the goal of being operational by September 2022. So we happen to have, worked on this policy change right smack dab in the middle of their migration plans. And so, the question was, is it going to be automated before the migration in all 3 systems? Is it going to be automated after the migration in the one system? And so where we ended up landing is it has been automated in CalWIN. So CalWIN is the first group to receive that top section, starting with Alameda and Contra Costa. You can see that all the counties in that top blue row that use CalWIN, those are the counties that first got automated with the THP NMD housing supplement. And the reason for that is because CalWIN is the last system that's migrating over. And so, they won't migrate over for a little while. So while they're waiting to migrate over, they'll be getting the supplement, and these other systems will be migrating over. Once they've migrated over, they will receive the supplement in CalSAWS, along with the folks that are in CalWIN and will have ultimately migrated over. But where that leaves us is, a timeline where July 1st, 2021, so starting today, the counties that are in the CalWIN system, will receive the THP NMD housing supplement. So if you're placing youth in your program, or counties, if you're placing youth in THP NMD today, in any of these top counties, and you're eligible for a housing supplement, which we'll get to very shortly, that you'll be receiving that on top of the rate. And now I know that you probably are seeing this language on the left-hand side where it says, or when CalWIN can perform the necessary automation to implement it. Now, fortunately, the automation folks moved very swiftly, rates moved very swiftly. We really appreciate that. This got done on time by July 1st, 2021. The new rates, or the housing supplement amounts, will be included in the CNI ACL that's coming out shortly. And then next year, and this is all written into law, these deadlines. It's written in that the other counties that are in C4 and in LRS, and ultimately be CalSAWS, will be functional by September 1st, 2022. Again, language, or when CalSAWS can perform the necessary automation to implement it. Now, we don't yet know if these will go on time on that September 1st timeline. I think it's promising, it's hopeful. Went really smoothly this year. So we'll, keep tabs on it for next year and see. But September 1st is the goal for the other counties. So which counties will be eligible for the THP NMD housing supplement? So because the methodology for calculating the THP plus housing, that should say THP NMD, it says plus, sorry about that. THP NMD housing supplement is tied to FMR and is responsive to changes in the housing market. As housing costs increase or decrease in a given county, housing supplements may shift from year to year. So, if there was some really significant change in housing costs in a county, they could gain or lose a housing supplement from year to year. That could happen. But more commonly, what will happen is, like I said, the amounts will shift from year to year, and it'll respond to changes in the housing market. And also we'll see those increases in the THP NMD rate. So there'll be, it'll be recalculated every year. But what you can see in the gray box is that based on 2021 FMR, and based on what looks like it will be the 21-22 THP NMD rate, 18 counties would qualify to receive a supplement for youth who are not custodial parents. 13 of those counties use CalWIN and will start receiving it July 1st, 2021. Now, for parenting youth, you can see the vast majority of counties qualify, 48 counties out of 58, qualify to receive a supplement for youth who are custodial parents. 17 of those counties use CalWIN and will start receiving it July 1st, 2021. Now, who are the counties? Let's look at that. So again, you'll have access to this PowerPoint because I know there's a lot. There's 58 counties here. And this is for non-parenting youth. So you can take a look and see, look for your county. Now, if you're wondering why there's a lot of NAs, that is because, again, the THP NMD housing supplement is only being automated for a group of counties for this July 1st date, right? So the counties with the asterisk are part of the second phase of implementation. And won't receive a supplement this fiscal year. Ideally, they'll start receiving it September 1st, 2022, contingent upon completion of the necessary automation changes. And then the counties that have NA with no asterisk, they are not eligible for a housing supplement as of yet. Again, that could shift, but we're not going to see great shifts. We might see one or two counties over the years gain or lose, depending on what our housing market looks like in California and individual counties, changes. But this is where we are right now. I'm going to move on, but again, you can get the handout from the handout section, or you can also wait for it when I send it later today if you want to look more carefully at this. This information will also be sent out and finalized and confirmed, because none of this is finalized and confirmed. There's no ACL out yet, but this is what we anticipate. And there might be slight differences in the ACL. So I just want to say that. I'm thinking the ACL could come out any day. Last year it was released on July 1st. I was kind of hoping we'd see it this morning and I could have, kind of all of this be final in the webinar, but maybe we'll see it later today. Maybe we'll see it later this week. So we'll see. These are the housing supplement amounts for custodial parents. For that, again, this amount goes from the county to the provider, and then the provider provides the housing or services for young people. So these are the rates and the housing supplements that providers receive on behalf of young people. So I just want to clarify, this is not money in hand for young people. Youth do receive a stipend, monthly stipend from their THP NMD provider, but these amounts are not the amounts going to youth. So I just want to make sure we're clear on that. And so you can see here, again, a majority of the counties have housing supplements. So I'm going to move on, and we're going to talk a little bit about the anticipated impact. So this is really, this slide is less impact, more just kind of extent of the supplement. But as I said, most NMDs are placed in counties that would require a housing supplement. Or actually, maybe I didn't say that. I was saying about 18 counties, for example, receive the non-parenting supplement. But the truth of the matter is, while that's just 18 counties, the majority of youth are placed in the counties that are receiving housing supplements. For non-parenting youth, 60% of them, roughly, approximately, are placed in counties that will be receiving a housing supplement, and for parenting youth, 94% are placed in counties who will be receiving a housing supplement. As I did mention earlier, supplement amounts in eligible counties may shift, or they will shift, in response to changes in the housing market. As housing costs increase or decrease, the amounts will change. And then the THP NMD rate will still receive annual CNI increases. So I just want to be clear on that. Each year, THP NMD housing supplement is applied after the CNI increase issued in the same ACL. So THP NMD housing supplement follows the youth. So again, just want to be really clear on this. This is probably one of the biggest kind of questions that might come up, I'm guessing, when NMDs are placed outside of the placing county, the host county rate shall be paid. So here's an example, so we can talk about this more literally. San Francisco County places an NMD with one of their THP NMD providers who houses youth in Alameda County. So I'm using this as an example because this is very common. The provider will not receive San Francisco County, City and County's housing supplement. They will receive Alameda County's housing supplement because the housing is located in Alameda. So just to be really clear on how this works with out of county, placement essentially, or just where the housing is located out of county. So where we get a little more complicated is with this automation, this space and timeline. So in the ACL that came out just, announcing the housing supplement and talking about the policy, if prior to CalSAW's automation, so if prior to full implementation of the housing supplement, if the placing county is a CalSAW's county, so one of those two counties that is not yet automated, and the NMD is placed in a CalWin county, the provider will receive the basic THP NMD rate until the housing supplement has been automated in CalSAW's. So, here's an example. We'll use LA and Orange. So LA County, which is not being automated until next year, places an NMD in Orange County who has been automated this year. So the provider will receive the basic THP NMD rate, not including Orange County's housing supplement amount, because LA County the automation is not yet complete for them. And so this was spelled out, this is literally, not the example, but the policy is straight from the ACL. So that is, and people are asking what the ACL is. I have a slide that will provide a link to it and the number in just a moment because I don't remember it offhand, but it will be shortly showing up on the screen. And so this is information that the ACL provided and was very clear on that there has to be automation in the placing county. And so there will be, until it's fully implemented, some limitations. So one more slide on, this is more actual anticipated impact, and then we'll get to the ACL and we'll get to some next steps. So these are kind of corny examples I picked. I'm not good at naming, don't ever have me name your THP NMD provider, like your program, because these are silly names, but I came up with a few examples of pretend provider names. So let's say Youth Achieve THP NMD is unable to secure apartments in their county because they can't afford the rent in most neighborhoods. Their county would like to place additional youth in THP NMD. However, housing unaffordability, limits capacity to 8 youth, say. So the idea is, with the THP NMD housing supplement, Youth Achieve would now be able to secure an additional 4 units in the community, because they'd be able to compete on the private market more efficiently, right? They'd have funding to do that. Another example, so Youth Strive THP NMD rents apartments in a neighborhood with no public transportation nearby, and the closest school is an hour commute. This limits youth's ability to meet their educational goals. So with the THP NMD housing supplement, Youth Strive can now secure apartments 15 minutes from campus, close to bus routes. So these, as you can see, are just examples. Of course, this is not exactly how this is going to play out for every provider in every county, but these are just some examples about what the intention of the supplement is and what we hope, and what we anticipate to be achieved. So Youth Action THP NMD can only afford to provide shared 2 bedrooms for their residents, even in the case of custodial parents. So with the THP NMD housing supplement, Youth Action can now rent 1-bedroom apartments for the custodial parents and their children in the program. Youth Now THP NMD would like to hire an education specialist to provide additional support to their residents in the area of education, but after covering rent, the monthly rate does not allow enough funding for additional staffing. So with the THP NMD housing supplement, Youth Now has sufficient funding to cover rent, and they can also now cover, providing specialized educational support to their residents by hiring a part-time staff to provide these services, because they're now, their rent is fully covered. So those were just a few examples. There are certainly others, and this will certainly look different in every county. So let's move on to next steps. Now, what do we believe people should be doing right now? So if you're a county representative, and these are maybe very obvious to people, but let's talk about them nonetheless. First, determine if your county will receive a housing supplement for non-parenting youth and or parenting youth, custodial parents, when it takes effect. So also understand what the policies are, right? Understand the out of county situation, understand the, just kind of the workings of it. Inform your THP NMD providers of this rate change and its policies. And then consider the need to increase THP NMD placements and discuss with your providers. So if there's been, setbacks or obstacles to increasing THP NMD placements in your county, we hope that this is an opportunity to increase access to these placements. And then discuss your current approach, in your county, what the approach is to serving parenting youth, and then also discuss where units are located for all youth, not just parenting youth. Maybe I should have put that a little different on that last one. But do you use 1 bedroom, or does your provider use 1 bedroom? Plan to do that now. Can you increase the number of parenting youth you're serving? Was there previously some sort of cap, or maybe informal cap? And also, as I said, just housing arrangements in general, kind of where are your units located? Can they be in an area that's more conducive to the needs of young people, if that's been a limitation? So the next steps for providers are pretty similar, but again, determine if your county will receive the supplement and when it takes effect. Ensure your county partners are aware of this rate change and its policies. Make sure they have the ACL that I'll share shortly. Make sure that the ACL that comes out, that's out there as well, and that people are aware. Consider expansion of housing capacity based on local needs and discuss with your county partners. And then consider your current housing arrangement for custodial parents and how many custodial parents you serve. And then again, I don't think this is on here, but consider your location of your housing and how, if necessary, you might want to change that. So I probably should have done this in a different order. The ACL that I keep referencing, I think, is the very last slide, but to cut in here, this should have probably been the last slide. I want to remind everyone, since we have a ton of providers and a ton of county representatives on the phone or on the webinar, that very shortly this month, an annual report survey is coming your way. So please, please be responsive to it. You know, this, we issue an annual report, you know, on THP, NMD, and THP Plus. We do this every year. This year, the report will be expanded. We're going to include information on SUP and FYI vouchers, the new Transitional Housing Program funding and Housing Navigators Program funding. And then, you know, I just really ask that, and people are always great about this, I really just ask that you are responsive to the emails, you complete the surveys. If you have questions, you follow up with me. And I want to just make it clear, it's because of the data provided in the surveys that we were able to advocate for policies like the THP-NMD housing supplement. You know, we see this as your part. You know, completing the survey is your part. We'll take it to the legislature and we'll work with them and identify a champion and work with that office to get these things passed. But we you know, this is a group effort, and we see this as a collaborative, you know, effort. And we just ask that, you know, please complete that survey and communicate with us as questions arise. So lastly, I will turn to the slide I probably should have put way earlier in the presentation, which shows on the left the housing stuff, or the ACL that came out on the housing supplement that talks about the policy of the housing supplement. So it talks about, you know, just the fact that it's been established, what it does, how it's calculated, the policies around it, and that's the link to the ACL on the screen. It's ACL 20-121. It was issued last year in October. And then there is a forthcoming ACL, again, could be today, could be tomorrow, could be next week, that provides an adjusted, you know, schedule of rates for all foster care rates, reflecting the CNI increases. And this will newly include the THP-NMD housing supplement amount. At least that's what we have been, you know, told by DSS. If any changes have occurred, then, you know, I don't see changes occurring in that way. We know that that's the plan, is to have those amounts included in the ACL, but it is just not yet out. So once it's out, I'm also happy to circulate that to everyone who registered for the webinar. Maybe that would be helpful. So we're going to launch into Q&A. And so if you have additional questions, please, you know, type them into your control box, your control panel, and hit send. And if there's questions at a later date, you know, feel free to email me, and that's my email address. And also just think about, if you're not already signed up for our weekly policy newsletter, doing that, because we get a lot of questions from people, and we're happy to provide those, you know, that individual technical assistance, but a lot of information is provided in those weekly policy newsletters. So I really encourage people to sign up for those. So someone asked, how does this work for LA County? So I do think we covered that. It would be automated likely next September, or whenever the automation, you know, is complete. It would be available hopefully by September. That's the goal. And again, it was done on time this year. I'm hopeful, and it's very encouraging that it was done on time this year. So we expect it to be next year. And you know, oh, thanks, Anna. Anna looks like she's going in and also doing some typing some question answers. Thanks, Anna, or some typing some answers. Another question is, are young adults eligible for THP Plus and eligible for the extended benefits that are due to end? I'm not quite sure what that question is. Eligible for THP Plus. Maybe this is just a question about the extended foster care extension. I'll just answer that. That's not related to this housing supplement, but I'll answer that because there's a lot going on right now with the state budget, and you know, it should be signed, if it hasn't been signed already, very, very soon. And so what's in the state budget is additional funding for extended foster care, for kind of the extension of extended foster care. You know, what it is quite literally are the extended foster care benefits and case management, or excuse me, foster care, you know, benefit payments and extended and case management for youth who turned or will turn 21 on or after January 27th, 2020. Those youth are, the federal government has mandated that states allow those youth to stay in care through September 30th of this year. And then our governor extended that offer or that, resource through the end of the calendar year to December 31st, 2021. So what we're looking at are extended payments and extended case management support through the end of the calendar year for young people, regardless of, age, whether they're turning 21, 22 even, if they turned or will turn 21 on or after January 27th of last year, they're eligible. So I hope that answers that question. Says, hi, I'm unclear who funds the supplement. Will counties without the THP NMD housing supplement have to pay the difference for placements in different counties? So the state has funded the supplement. So $4 million was included in the current year's budget to fund this, and that's ongoing funding to fund the supplement, and it would be passed down to the counties to then administer to the provider per youth per month. So your question, counties without the supplement. So there's no mandate that counties without housing supplements would be paying out of county only funds any additional funding. It would come down from the state. So just to be clear, if there's ever, this is in law, if there's ever a mandate that requires counties to pay, if it's new programming or a new mandate that was made after funding was realigned to counties in 2011, foster care funding, if it's a new mandate for counties, it has to come with state funding. So this came with state funding, so counties are not on the hook for paying this out of their, county only dollars. I hope that answers that question. It says for the, let's see. Okay, so it says for the custodial parents, we either provide housing in a 1-bedroom or place 2 parenting youth in a 3-bedroom, 2-bath apartment. Interesting. So the kids have a play area and they have their own bathrooms. How would that look for the housing increase? So there is no, and this is a question I think that I figured would maybe come up a lot, is is there a mandate that to get this funding, do providers have to place your parenting youth in a 1-bedroom? So technically, no, there's nothing in statute or in ACL that says that funding is contingent upon placement in a 1-bedroom. However, I would consider, consulting with your county about what you all think the best practice is. Now, obviously, placing parenting youth in a 3-bedroom is more expensive than half of a 2-bedroom for a non-parenting youth. So you're still, I'm guessing, needing to be funded at a higher rate. And if that is a best practice, who am I to say what a best practice is, right? If your county and your organization find that is the best, healthiest environment for parenting youth in your program, there's nothing in statute that says, no, it has to be a 1-bedroom. But, I just will say the intent is to provide larger housing accommodations for young people and their children. That is the intent. And so we would hope that would be how the funding is used. And I would think that counties that are placing youth in this program would feel the same. Okay. So someone said, does this apply? I might have missed this, but does this apply to houses as well as apartments? So yes, this isn't contingent upon the housing setting. It's basically, this is tied to THP NMD generally. So it's all based on whether your county is eligible for the supplement. Now I see we are at time. I will answer maybe 2 more questions. I guess I didn't let you guys go early. Probably shouldn't have said that. I jinxed us. But I'll answer maybe 2 more questions for folks who want to stay on, and then we'll close. Okay, it says, if my agency's office is based in Contra Costa County and the youth is in an apartment in Sacramento, what rate are we paid? So it's where the housing is located. But again, before things are automated, it could be tricky depending on whether the county, the placing county has been automated yet. So Contra Costa County is one of the counties that's been automated. So in that case, you could receive a supplement, but it would not be Contra Costa County supplement. It would be whatever the county where the housing is located, it would be their supplement. And they may not have a housing supplement. So you have to look and see if that county even has one. Let's see. Look for one last question here. Okay, will the supplement payment be retrospective for counties that are late in automation? So no, so there's no, that is not happening. So the counties who are automated in September or whenever it is that, if it occurs September or if it occurs October, that is when they will begin to qualify and when they will begin to receive the payment. So there's no like retroactive payments made. So I'm going to go ahead and close. I know there's a few more questions, but I see that we're at 11:03, and I want to respect everyone's time. But again, feel free to email me if there are outstanding questions that weren't answered in the presentation, and I will follow up in an email to all of you with this, the slides, the recording, and when the ACL is out, I will also send that to all of you. Thank you so much. Be ready for some exciting, emails from us and exciting, if you get our newsletter, exciting news. As I said, the state budget is very soon or has already passed. And there's a lot of great stuff in there for transition age youth that are, in foster care, have left foster care, have experienced homelessness. There's a lot of resources this year. So we have a lot of good news to share, and we'll be in touch. I hope everyone has a really great long weekend and stay safe. Thanks. Bye-bye.